Cigarette smoking is a serious fatal risk factor for cardiovascular disease and is highly prevalent among patients with type 2 diabetes. It is known that smoking exacerbates the combined harmful effects of hyperglycemia and other risk factors, accelerating vascular damage in patients with diabetes. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about new smoking cessation drug Varenicline in diabetic people. Evidence of effective smoking cessation interventions in patients with diabetes is limited. The unique behavioral and metabolic characteristics of smokers with type 2 diabetes to justify the recent trial of the smoking cessation drug Varenicline. A randomized clinical trial in JAMA network involving 300 patients with type 2 diabetes who smoked found that this drug was efficacious at weeks 12, 24 and 52 of the trial compared to placebo. Nausea, insomnia, abnormal dreams, anxiety and irritability were reported at higher frequency among patients in the Varenicline versus placebo group. No treatment-related serious adverse events were noted. The multi-center, double-blind, placebo-controlled randomized clinical trial recruited patients from 6 outpatient clinics in 5 hospitals in Catania, Italy. Patients with type 2 diabetes who were smoking at least 10 cigarettes a day and who intended to quit smoking were screened for eligibility. Eligible patients were randomized to either Varenicline or placebo treatment. The trial consisted of a 12-week treatment phase followed by a 40-week follow-up, non-treatment phase. The primary efficacy endpoint of the study was the continuous abstinence rate, that is CAR, at weeks 9 to 24. The CAR at weeks 9 to 24 was significantly higher for the Varenicline than placebo group. The CARs at week 9 to 12, that is 31.3% versus 7.3%, and weeks 9 to 52, as well as the 7-day point prevalence of abstinence at weeks 12, 24 and 52 were also significantly higher for the Varenicline versus placebo group. The most frequent adverse events occurring in the Varenicline group compared with the placebo group were nausea, insomnia, abnormal dreams, anxiety and irritability. Serious adverse events were infrequent in both groups and not treatment related. Results of this trial showed that inclusion of Varenicline in a smoking cessation program is efficacious in achieving long-term abstinence without serious adverse event. Varenicline should be routinely used in diabetes education programs to help patients with type 2 diabetes quit smoking. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.